Okay, so as I say, David unfortunately can't be with us today, so you've got me standing in his stead. And I actually was involved in this work, and it was all based around a piece of work that we were asked to do on behalf of UK government. The government chief scientific advisor during the pandemic set up a number of very large-scale programs called National Core Studies. I was asked to lead one around transmission of the virus. So that was a £22 million program over a couple of years. And one of the things that we did within that program was work with an organization called NatSen to collect data that allowed us to understand exactly how people felt about work during the pandemic. So what David's done is pull together a presentation that focuses specifically on job satisfaction and the perception of work-related stress during the pandemic period. So, what we did was a large panel survey with the organisation called NatSen. We ran the survey in March 2022, and it covered a period from that point to 2 years earlier, so basically the start of the pandemic. As part of NatSen's daily business, they collect a huge range of information from panels that they set up. So they've got geography, they've got educational status, age, gender, etc. Within their panel cohorts. What we asked them to do was to add in some additional questions, which you can see on the screen here, relating to general health, comorbidities, common symptoms, and then some specific COVID information. So information about COVID vaccination status, how many doses they'd had, the dates they'd had them, how many episodes of COVID they've had, how many symptoms they'd experienced if they'd had the disease. And importantly, we collected information about their jobs, their job satisfaction, the modifications made to the workplace on behalf of the employer, and changes that they'd experienced over the lifetime of the pandemic. So a really rich data set that enabled us then to do a whole series of analyses. For each individual participant, we collected information about the job that they did, so their sector, their title, their SOC code, where they felt their COVID infection originated from. Was it at work? Was it from family members, etc.? And when it came to understanding what was going on in the workplace, we gathered information about what mitigations had been taken by the workplace to control the exposures, whether risk assessments had been carried out, and in the UK it was a requirement for all companies to undertake what we called a COVID-secure risk assessment, and what mitigations have been put in place, ventilation, screens, social distancing, etc., etc. We asked some specific questions about how people were feeling, so you can see a couple of them up here. How satisfied are you with your job nowadays? So that's at the end of the pandemic period. And overall, to what extent do you feel that the things you do in your job are worthwhile? Just to give an indication of how people felt when it came to the work that they were doing. And then questions about stress and how people found their work during that pandemic period. Was it stressful or not? And was that work more stressful, less stressful, or about the same as it was before the pandemic? So getting that picture of how things had been affected by the pandemic and whether their stress levels had changed as a consequence. Okay, so first data slide is around the population that we looked at. As I say, NatSen have these very large panels, so they approached just under 10,000 people. 7,000 people accessed the survey online, and we ended up with 5,886 participants. So quite a decent-sized sample. The demographic split was roughly aligned to the UK population, so mixed, obviously female, males, and ethnic backgrounds, sort of more or less matching what we see around the UK. So in terms of the actual findings, Again, this is quite reflective of our Office of National Statistics data, which collects general UK population data about health. So about a third rated their health as very good, slightly more as good, and then decreasing numbers of people thought that their health was not good. The presence of comorbid conditions was low, with the exception of commonly reported diseases like diabetes and asthma, etc. And clearly, stress and depression were above the norm here. So reflecting the fact that stress, anxiety, depression is a common health problem within UK workers generally. So when we got to the questions about satisfaction of their job, most people were quite satisfied with the work they were doing, median 8, and you can see the variance there. And most people also felt that what they were doing was worthwhile. So perhaps not what we were expecting, because the general perspective on the UK workforce is they're quite miserable and they don't like what they're doing. But actually this shows that they do quite like it, and they think that what they do is making a bit of a difference, which is really good to hear. Then we looked at the stress levels and how people found their main job between January 2020 and basically 2 years hence. So you can see here that people felt their jobs on the whole were moderately or extremely stressful during that period of the pandemic, with a smaller percentage feeling that it wasn't stressful at all. And when we asked them, was that more stressful, less stressful, or about the same as before the pandemic, most people thought it was more stressful during the pandemic than it was prior to that. So clearly the pandemic had an impact on mental ill health during its progression. So David also done some unadjusted analysis, and the factors that were associated with this increase in stress. So workplace factors associated with less increase in stress were the ability to work from home. So if you work from home, you were not as likely to be more stressed. If you were not working with the public or people who had COVID-19, you were not as stressed as those who were. And if you weren't a key worker, you were less likely to be stressed. And the key workers in the UK were people who had to carry on doing their work during the pandemic. So I think that's probably understandable. So those factors that were associated with a more of an increase were that employers were putting measures in place to reduce infection risk, which is almost a sort of a counterintuitive finding, but probably the fact that people were working in an environment which had changed and where new things were being put in place and their jobs were having to be altered to enable them to carry on working probably accounts for that particular finding. If you're in the education sector or the health sector, accommodation and food sectors, trade and retail, all of course associated with contact with other people, you can see how those stress levels were also increased above others. And in terms of the personal factors that were associated with increase in stress, females were reporting more stress than males. If you're in that 30 to 49 age bracket, you again reported more stress. And those who had no partner and reported themselves as divorced or separated also reported more stress. So having that support network clearly was critical and important. So I think the points that David wanted to make was that this is a large study. This is only one element of that. It's telling us lots of things about the work environment and its response to COVID. The general health of the population that we've looked at was equivalent to that's reported by our standard UK systems. About a fifth reported lower job satisfaction, and about 10% found their work extremely stressful during the pandemic. More than half of the participants identified that their work-related stress worsened from pre-pandemic levels. And interestingly, employer actions to reduce that risk were associated with increased stress. And then finally, certain characteristics also appeared to increase stress as well. So it gives you a bit of an insight into that nearly 6,000 people, their approach to managing and dealing with stress, and how they felt as a consequence of the pandemic. So I'll stop there and very happy to take any quick questions. Thank you.